Thank you for joining me on the Fire Rescue Wellness Podcast. I'm your host, AZ. I find the research and resources and then provide the fire service with the so what, now what, to ensure the health and well-being of every member of our profession. Together, let's thrive. Hello, everyone. It is AZ again on the Fire Rescue Wellness Podcast. And today I'm recording at Fire and Iron Studios in Chicago. And on the phone, I have my dear friend, Katie Dabrowski. Katie, say hello to all of the people.
Hi, everybody. Thank you.
Yeah, I'm so excited. We've been like fangirling about this conversation for a month, so we're both pretty excited. We'll try to contain it. But Katie and I know each other. We met through the Society for Neurosports, and that is a very small niche society founded by Dr. Jamie Tartar from Nova Southeastern. And both of us were attending the first conference. I believe Katie was also presenting. And then we just became fast friends after that. So in order to get a really good start today, Katie, I have the lightning round. Are you ready?
I am so ready.
You are so ready. Okay, Queen, here we go. First question. Who is Katie Dabrowski?
I am a doctor of physical therapy and a business owner in Miami, Florida. So I co-own Old Bull Athletics in Miami, Florida with my business partner, Frankie Telfort. We have a completely one-on-one cash-based physical therapy and strength and performance facility, 2 locations actually now in Miami. So physical therapist, and then I also am an adjunct neuroscience professor at Nova Southeastern University, where I went to undergrad. So those are the 2 hats that I mainly wear.
Just in case you're not reading between the lines, everyone, Katie is a brainiac, just so you know. Okay, Katie, what sets...
Your words.
My words, and they're true. Katie, what sets your soul on fire?
Biggest thing is probably giving people the type of healthcare they deserve that they've probably never yet experienced.
Ooh, we're going to talk about that later, so don't go too far in your brain from that topic, people. Okay, Katie, how are you single-handedly changing the world?
Definitely not single-handedly. I think it comes back to what I just said about setting my soul on fire. We have a phenomenal team at Old Bull Athletics, and it sets all of our respective souls on fire. And that's the big thing. We're trying to change the landscape of healthcare, not only for the patient experience, but for the provider experience. We're trying to create an environment where patients have the best possible outcomes, and they're treated with, the utmost respect and the care toward their pain and injury. As well as providing a place for healthcare providers, for physical therapists and coaches to give the kind of care they've always wanted and to be in a facility that really values how much they can contribute to the mission.
All right, Katie, this is such a good segue. I love this because the thing that I wanted to jump into with you right away is sort of, there's a problem. And if you're listening today, this might be new information for you. So listen up real closely. There is a problem with the healthcare model, and there is a very big problem with the traditional physical therapy model. And Katie actually made a good point. There's not a problem only from the perspective of the patient, but also from the provider. So let's actually break this down and let's talk about it first from the perspective of the provider. Katie, what is the problem with the traditional physical therapy model from the perspective of a provider?
Yeah, I love this question because I feel like, rightfully so, we often focus on how important we have to change healthcare for the patient. Like, absolutely, it's all about the patient. But I think we tend to forget how important it is to actually have a system that allows a provider to treat the way that evidence and experience best gives them information to treat, and also in a way where they don't feel burnt out. So from a physical therapy perspective, reimbursement rates from insurance companies are constantly being cut. It's crazy the amount every year we're getting information about percentages being cut towards how much reimbursement rates are actually paying out for the work of physical therapists. So what that means in short is therapists at traditional clinics have to see more patients per hour so the business can make enough money to keep the lights on, essentially. So the problem from a provider standpoint is I want to make sure I give everything that this patient needs to get better. But oh, by the way, I have to do it at the same time as I'm doing it for 3 or 4 other people, which is crazy. Would you ever expect to go into any other medical providers or any other type of profession and say, okay, yeah, I'll do my appointment with 3 other people. That's fine. Or, okay, yeah, it's crazy. Or, okay, I'll see my therapist for 10 minutes and then I'll get handed off to a volunteer or a tech or an aide. While those roles are important for supporting physical therapists, it waters down our profession when we cannot provide the type of treatment that really shows that, our education and our background has afforded us the ability to differentially diagnose, to make sure we get really good outcomes, to provide a safe and progressive experience for the patient. It just waters us down when we're juggling multiple patients at one time, or we're relying on the support of, undertrained people to pick up the slack for us.
So I remember I haven't gone to a traditional, and I hope that this is not an offensive term, and I do not mean to offend anyone listening, but there's this term we use called a physical therapy mill, and that's kind of the
Yeah,
experience that Katie is describing, where you go in, you see your therapist for 5-10 minutes, and then you're pushed off on a high school kid with a yellow minivan. But I haven't
right.
been to that type of an experience for a very long time, but I do remember watching my therapist trying to juggle, again, 3 or 4 people at one time, and then also telling me that she had hours worth of documentation to do at night
Yes.
at home on her own. So like Katie said, that's a recipe for
Unpaid.
unpaid. Yes. That's a
Yeah.
recipe for burnout. It absolutely is.
And then people the thing is that our profession is so cool. Like, even in the busiest of clinics, I feel like we can often forget how stressful and how high the level of burnout is, because you can have, that one patient interaction that makes it all worth it that day. And it kind of makes you forget about how stressful the job is and how undervalued the profession is, and how high rates of burnout really are quite pervasive, because even that flicker of helping somebody, or that flicker of getting a patient somewhere that they didn't expect, I think can offset like the kind of negative tone. And then you can get stuck in that loop, right? So you're going home kind of thinking about the day and being like, oh, wow, I still have 3 hours of notes to write. This is exhausting. You look at your schedule for the next day, you have 5 evals intermixed with the other 15 people you're somehow supposed to cram in. And it's really easy to get kind of stuck on like the treadmill kind of it. It's not the therapist's fault for this system. Therapists go into this because we love what we do. It's not their fault that they're in a clinic that's too busy and they're in a clinic that doesn't pay them what they deserve. It's just what people get stuck in. And that high burnout rate, it's so unfortunate, because you're starting to see a lot of physical therapists trying to find other jobs and getting out of the field entirely, which is heartbreaking, because it just doesn't have to be that way if you're able to be in a setting where you can give the time the patient deserves. You as a provider can get paid what you're worth, and you shouldn't have to take home work with you and do tons of documentation where you're basically begging somebody without a medical license, an insurance provider, to reimburse this patient's sessions.
Preach it, queen.
I
Okay.
get fired up.
I know. This is why I want to talk to you about this. And just so everyone knows, I mentioned that had been at a previous physical therapy mill, and then Katie said there's that one patient that just lights up your day. I'd like to think that I was that one patient. Denise Smith,
Absolutely.
Denise Smith, if you're listening, please confirm. Okay. From the
The
patients.
only reason they're still practicing is because of you.
Well, and Denise started her own clinic. She moved away, started her own clinic, and I can't confirm that she's cash based, but I do suspect it. So I should follow up with
Most
Denise.
likely. That's awesome.
Most likely. Okay, Katie, from a patient's perspective, just right before we hopped on the call, I was having a conversation with my man Jeremiah here in the studio. He's the sound guy. And I was just telling him about the conversation that we were going to have, asked him if he'd ever been in physical therapy. And I kind of explained that concept of the mill, and he's like, "Yeah, I get that. I've experienced that." But from a patient's perspective, tell us about that experience, Katie.
Yeah, absolutely. Um, so this is where I get frustrated because, and we've talked about this before, the perception of actually what physical therapists are and what we know and what we do and the type of school that we've had and the knowledge that we have and the type of conditions that we can actually like differentially diagnose, meaning we can rule out stuff that would be not within our scope of practice and refer people to the according professional. People have no idea that we do that. People have no idea that we are doctorally trained. They have no idea that we take the same or even more intensive like musculoskeletal and nervous system anatomy than a lot of other medical providers. They have no idea the type of coursework that we do. But I kind of don't blame them for not knowing, because if you walk into kind of the mill clinic that we're talking about, there's 10 tables in a row. There's like old carpet and smooth jazz playing, and there are people sitting at computers and feverishly typing notes while a tech hands somebody a resistance band. There's dumbbells that don't go up about like past 10 pounds. There's nothing in that facility to make it look like, oh, this is full of doctorally trained experts in physiology, movement, exercise, neuroscience. So I completely understand, while also being frustrated by the fact that people don't know what we do. So as a patient going into these settings, we probably already have a negative connotation and predisposition about like what PTs even do, because you just see this setting and not really much is going on. So your perception is already quite low, most likely. And then you go in there and you realize, yes, you're being seen with multiple other patients, and you're probably laying on a table. You're probably paying for heat and ice and ultrasound and things that are actually in the literature shown to not do anything for improving outcomes at all. There's studies that compare the use of an ultrasound that's plugged in and not plugged in, and we have the same outcomes, nothing. So you're in these settings where you're not being challenged, you're not being pushed, you're being treated the exact same way as anybody else who could walk in with your injury, while not being taken into consideration that every single person's injury looks different. Every single person's goals and what they have to be able to get back to doing is different. You shouldn't be doing the same printout sheet of exercises for an older woman in her 80s who hurt her knee and a 16-year-old high school soccer player. But that's what those settings show. So you're getting an underdosed, lower level type of care that's not going to get you back to where you need to be. And it's no wonder that people say, yeah, I tried PT, it doesn't work. Because it doesn't work if the level that you're given for rehab doesn't even come close to what you need to do to get out of there and what demands that your body has to go through for whatever type of lifestyle, sport, activity, hobby that you need to get back to.
And in case you didn't listen around the edges, what Katie's saying is that a lot of that care that you're getting is, in fact, dictated by the insurance agent or insurance company. So, Katie, if she was working at a physical therapy mill, she could very well know that I need X, Y, and Z. But if her company isn't going to get reimbursed for those particular treatments, she can't give those treatments to me. So, being a patient in those situations it's difficult. Now,
Absolutely. Yeah. And to put it in perspective with kind of the insurance lens, as with anything, an insurance company is trying to find any way to not pay for what you're doing. And this is the case for everything, right? Like for car insurance and everything. But when it comes to physical therapy, there are these crazy arbitrary definitions and rules of what is deemed medically necessary to be covered. Basically, you have to be performing at a low enough level for it to be deemed a medically necessary intervention. So anybody that surpasses what an insurance company would deem what we call like within normal limits, or in quotations, functional, nothing else is covered beyond that point. But how many people have gone through physical therapy and been told they're done, but they're still nowhere near ready to get back on the field, ready to get back into CrossFit, ready to get back into hiking with their family. They've just checked the boxes that the insurance company has deemed appropriate and medically necessary for reimbursement. So for anybody, if I worked in that type of setting, I could get them just as far as I was allowed to from their insurance benefits, and then that's it. Then they're done and they're on their own, but they haven't been able to be pushed to the level to make sure that they're actually ready, because the insurance companies won't see that as a medical necessity, which is a huge problem in itself.
And just listening to Katie say that made me have a stomach ache because she talked about getting back to sport or getting back to performance. What about firefighting? The insurance company is going to let us get just as good as we need to be medically cleared. But what happens when we go back to work? Katie, can you speculate?
Oh my gosh. Yeah, absolutely. And I was, of course, since speaking with you, where my brain was going immediately, like somebody whose job is so unpredictable and stresses just about every energy system, every part of their body, everything you could ever imagine. There's no way that they're going to be prepared for that leaving a traditional physical therapy facility. There's just no way. But to do the things that I would want to do with a firefighter, and it would probably be quite similar to the intensity of, kind of an unpredictable CrossFit workout, and just throwing a bunch of stuff at them, making them, think on demand, making them change direction, making them really pivot their decision making, really stressing their body out, things that would never, ever get covered in an insurance company. So again, you'd get somebody who has a very high stress job, and okay, cool, their angle range of motion, or their ankle range of motion is deemed normal, so they're good, and that's it. So they've checked the boxes, but they've done nothing to actually test if they're ready for, again, their job, their sport, their lifestyle. Crazy.
And in our case, good enough is it's truly not good enough because so many of our firefighters re-injure within such a short time frame. It's incredible.
Absolutely. And I think one of the biggest things too, even beyond just like the physical type of care, obviously, how important it is to have time to talk to a patient about their experience, what they've gone through, maybe what any other provider has told them about what they're experiencing. Do they understand what the terms mean? Do they understand just the pain triggers? Do they understand their experience? And also being able to have time to really unpack a lot of negative and bad viewpoints of pain and injury. A lot of what my job is dispelling these crazy myths about pain and injury and making people realize that we are extremely resilient and that we're not fragile, and that, bending over won't cause your spine to explode, and things that you might hear from other providers. So people come in terrified. And if I didn't have one-on-one time for an entire hour to really dissect some of those pain beliefs, we wouldn't really make any progress, because somebody would still be scared and somebody would still think that, they're fragile and that they couldn't possibly recover, which unfortunately, those are the narratives that people hear from a lot of other providers.
I hate those narratives too. I'm so
I know.
fragile. I'm going to blow out my back. I just, you and I've talked about that before, and I just can't with those phrases.
Or people thinking they're out of alignment, or that don't turn that way because that's going to make your hip higher on one side than the other. Or, I had an x-ray and they told me that my right hip is higher. Oh my gosh, this is crazy. I need surgery. These are things that I have to constantly talk through with patients. And if I didn't have one-on-one time, there's no way we could even scratch the surface on some of these really, really deeply seated within healthcare and then within, patient beliefs. There's no way we could get to the bottom of those beliefs.
Well, Katie, I think of you as, because you came from kind of a neuroscience background. In my brain, I call you a neuroscientist. And so I have this belief from the bit of research that I've done on the topic that kind of any injury is also a brain injury. Now, am I wrong about that? Do we need to nuance my definition? Tell me more.
I think in general, that's correct. but breaking it down into a little bit, kind of what's really happening. But in general, yeah, I agree with you. Um, any injury changes from a nervous system standpoint, how everything's working. So injury, pain, those are fearful events. Those are events that would trigger like a stress response to occur, which of course starts with the brain, would trigger a sort of response to occur, kind of set off some alarm bells, to create muscle guarding, to create fear avoidant behaviors, to create thoughts about, kind of catastrophizing and getting worried about the injury. That's all neurologically driven. And those are adaptable things. That's stuff that protects us from further getting hurt. That's stuff that protects us from some sort of outside threat. But the problem is when those thoughts and those nervous system directed behaviors become chronic. So that's when it's maladaptive. In the short term, it means your nervous system is working. Like it's a good thing. It's like, yes, okay, I hurt myself. I should probably not do that. I should probably be a little bit more cautious. I should probably protect the area. But when it becomes really, really persistent over time, that's when we get stuck in a cycle, essentially, of a stress response and this fear avoidant behavior. So, and that's why people don't feel like they're getting better, or they feel like their pain is now just, it is what it is. So if you think about it from, let's use like deadlifting, for example. So just because this is such a common thing. So I have somebody who deadlifts and they kind of tweak their back. So after that, they are in pain and they are now scared of deadlifting because they've made the connection. Okay, if I deadlift, then I get pain. So now they're going to kind of self-select movements and behaviors that completely avoid the position that even looks like a deadlift, aka bending over, like a normal human thing that we need to do.
Mm-hmm.
So they stop bending over. They avoid spinal flexion. They stop bending forward. They stop picking stuff up. So they're going to get deconditioned to that movement. So they've stopped doing it. They're going to no longer be as competent and as strong in the position. So that deconditioning now persists, and they're continually kind of really ruminating and thinking of avoiding this behavior. There's a lot of fear surrounding this behavior. And then time goes by and they're fed up and they're like, you know what? Forget it. I'm going to try it again. And they deadlift and they hurt themselves again. Oh. Yep. They hurt themselves again because they were deconditioned to it because they avoided it for so long. And then the cycle just continues. So this is an overgeneralization of kind of the pain cycle, but it's a really easy way to think about it for somebody who has a painful movement. They're now scared of it and they avoid it. The avoidance of the movement led to long-term deconditioning. They get fed up, they try again. Their body really wasn't prepared because they became deconditioned. So the pain happens again. And it just happens over and over and over. So that's where, from a neurological perspective, pain is so deeply rooted in like our nervous system response to it. So that's why at the crux of any good rehab program, it really should be, all things considered. We're not talking about trauma. We're not talking about like post-operative here. We're talking about these type of kind of general aches and pains and orthopedic injuries. But a good rehab program is really just educating somebody on that process and then over time, progressively reintroducing them to the movement that hurt them in the first place, to build up their conditioning, to desensitize that nervous system stress response, and to make them feel confident again. That's really all it is, but we tend to completely skip over that and underdose, underload, and be like, yeah, we're not doing that movement ever again. It's scary, it's bad. And we're trying to avoid ever making people realize or ever making people think that way.
That was such an amazing explanation, Katie. I love that. So, okay, full disclosure. I know Katie. I know that she's a co-owner of Old Bull Athletics. I have never been to Old Bull Athletics because she rudely keeps scheduling these awesome events when I can't make it. So I've never even been there. But here's how rude. Here's what I know. Old Bull Athletics is an experience. I've never been there, but I know it's an experience. I've never met Frankie. I've never met Hannah. I've never met Audrey, but I feel so invested in all of them. They have a great social media presence. They have a great online presence. The women of Old Bull do Red Pants Friday, which I am all about as of last Friday. But
And the men do too now.
they do?
Oh
How?
yeah, we all wear red pants.
How cool.
Yeah.
Well, so that's my perception of Old Bull. It's an experience. But I want you to tell me from your perspective, Katie, how is Old Bull different?
I thank you, first of all. I love that you described it that way. And I don't know if I've ever quite myself articulated it that way, but I agree with you. I think it is an experience. The main mission at Old Bull is to really provide the level of care and experience and welcomeness that would typically only be given to a professional athlete. You walk in the door and we have squat racks, huge kettlebells, a turf, a lot of awesome, really high-end gym equipment. And it's bright and rap music is playing. It's fun. Everybody's having a good time. And you might expect that it would only be a place for people with an extremely high training age, people who are professional or super high-level athletes. You would probably expect that if you just saw what it looked like. But the cool thing is when you walk in, there's actually people of every background, every age, every experience in there. So our entire mission is to basically make every single person who walks in the door feel welcome and that they belong in a gym that looks like ours, wherever they are at along the spectrum of their health and wellness. So we are doctors of physical therapy and strength coaches, exercise physiologists, performance coaches. We're able to offer and meet anybody where they're at when they come into us, anywhere along the spectrum of traditional, injury rehab, all the way to performance and strength, and then all the way to like really high level return to sport or activity. So by being able to offer this to every type of person, we're really helping people understand that everybody deserves this type of care. Everybody deserves to learn what it feels like to get stronger and to do things that they did not ever expect themselves to do, whether it be because of pain and injury, because of lack of experience, or because they just thought like, oh no, I'm not strong enough, or I'm not young anymore, or oh, maybe I could have done that before. We don't buy that. We're giving that like type of care to everybody. So that's the experience. That's what you're going to get when you come see us.
Just so you know, Frankie casually promised me a location in the Chicagoland area. He may not remember it or he may deny it, but it's true. Old Bull is coming to Chicago. You heard it here first.
Breaking news.
Breaking news. So a few weeks ago, it might have been a month ago now, Katie basically blew up Instagram with one of her little casual posts that said, strength training is physical therapy. And she basically won the internet, not for that day, but for like weeks afterwards. But from say an end user perspective, Katie, what did you mean by that?
Yeah, I think actually even more specifically, and from a general term, strength training is healthcare. So yes, it's totally physical therapy, but also just healthcare as a whole. We know at this point, like there is just countless information out there about the overall benefits of exercise on pretty much like every outcome of health that you could ever look at. But also from a strength perspective, from building muscle, but also building confidence. Like those things are so linked together for healthcare outcomes. There's just at this point, there's too much information that shows us how important being strong is for not only just, you want to look a certain way or you want to be able to perform a certain way, but for long-term healthcare. And that is also directed at kind of what we talked about in the beginning, that ridiculous not deeming certain things medically necessary for insurance reimbursement or for it to be considered as physical therapy. It blows my mind that a squat, like a heavy barbell squat for When somebody is in late stage rehab and I'm trying to increase tolerance of their tissues to heavy movements, and I'm trying to have a hypertrophy effect to build them more muscle, to give them more strength, to be more resilient in the future, it blows my mind that that is not deemed medically necessary, that is not deemed healthcare, that is not seen as something that is carried out by a medical provider. I can't really wrap my head around that. So that phrase, like strength training is healthcare, I've seen it on shirts and on, people have said it before. So it's definitely not an original statement. It's just something that I believe in so deeply. And I just don't understand how we are still at a point where we're trying to defend getting people stronger as being part of their healthcare plan. Crazy to me.
Drop the mic right there, Katie. Just drop it. Okay, so before we start transitioning to a few closing questions, I want to kind of make this all about me now, Katie, and not me specifically, but me, the fire service. As you may know, statistically, firefighters hurt their low backs, shoulders, and knees, I believe in that order. And I've kind of traced it to the fact that we wear boots that lock our ankles down. So we have, and gear that kind of locks our hips down. So we have two areas that should be very mobile, being very locked down. And then further, we add a big air pack to our T-spine. So now our T-spine doesn't move either. So that's kind of like we're locking down things that should be moving freely. And so what can the typical firefighter address to maybe mitigate their risk for injury to one of these areas? What do you think?
Yeah, I like your analysis too of probably what's contributing to it. Yeah, I mean, we have like a whole body system that's supposed to kind of work together and do its thing and absorb forces. And if you're in really restrictive gear, it's just not going to be able to do that as well. So definitely working with a coach or a provider for some kind of, I like a combination of strength and mobility drills, more so because I don't love just kind of these rolling around on the floor mobility exercises that really aren't loading you and really aren't giving like that kind of nervous system input of muscles contracting and muscles moving. So definitely strengthening in a ton of different ranges. Like the best mobility training, in my opinion, and in a lot of people's opinions and science's opinion, is to load your body in a lot of ranges of motion. We create range of motion, we maintain range of motion in positions that we load. So being stretched by somebody feels good temporarily, but it's not going to create a lasting change in the elasticity and the length of our tissues. What does is getting our muscles stronger in a whole slew of different positions. So I would definitely recommend that. And I know you, Annette, you harp on this stuff so much that I would also argue that at the end of the day, more of this issue and this high incidence of injury is because of lack of sleep, super high stress levels, a really difficult job, being constantly uprooted from going back and forth from shifts and being at home and then being at the station, trying to get sleep, but being on high alert because you don't know when the alarms are going to go off. So I would also argue at the end of the day, what's probably going to move the needle the most, and it's unsexy and it's not even really like a physical therapy thing, is trying to manage your stress, trying to really come up with a good sleep routine, trying to add in things that bring you joy, that can get you out of the intensity and the difficulty that is being in fire or police or any of those type of positions.
Katie, I'm going to disagree with you, girl. I think sleep is very, very sexy.
That's true. That's kind of your thing.
That's true. Okay, so I have one last question. So the thing that we really didn't dive into, we alluded to it, the insurance model and how it's a bit broken. Okay, it's very broken, but we really didn't dive into the cash-based model. So here's the beautiful thing about the cash-based model. Katie can get you better, likely much more quickly than a traditional physical therapist can, because she's not handcuffed to what she can be reimbursed for. So the cash-based model, it sounds scary because you're paying cash out of your pocket. And then I usually just resubmit that to my insurance coverage afterwards, and sometimes get things covered, sometimes don't. But how, Katie, give us some last parting thoughts on how that cash-based model might be really, really beneficial to firefighters who are injured.
Yeah, absolutely. I think probably my favorite thing about being cash-based, even beyond not having to listen to insurance companies and not having to document more than I treat and not having to, like you said, be handcuffed to all of that. I think my favorite part about it all is being able to, every time I get a patient, I am so challenged to really show them how good we are and how much faster I can get them feeling better. Because I'm sensitive to the commitment to selecting to not use your insurance company. With that being said, it's a lot more affordable than people would think, especially if you're comparing seeing an insurance-based practitioner several times a week, X amount of weeks, paying a copay, maybe even having a deductible to hit. But regardless, being a cash pay provider means you have to be very good. You have to be able to show that person, even in that first session, how serious you are about getting them better faster. One of my favorite things is to be able to tell somebody, okay, cool. Let's say 4 weeks. You come in once a week. You do the homework I give you. We are going to really focus when you come in here. You're going to feel better. To be able to give that information to somebody instead of the traditional, all right, it's going to be 3 times a week for 12 weeks. That's huge. And that also elevates me, right? That elevates all of us who are cash providers to be able to give somebody an extremely high level of care, to make every minute count of the hour that we have with them, and to really, really work on getting somebody to their goals and getting them feeling better. If I was in a different setting, I wouldn't probably be as motivated because I knew I had X amount of visits. I have them 3 times a week. I'm juggling multiple patients, so I have to sit you with e-stim and ice for 15 minutes, and then I'll come back to you in a second. But for us, it's every minute of that hour we're with you, we are working and we're getting you better, and we're really, really focused on super, super high level outcomes.
And I would add 3 times a week for 12 weeks as a business model, not a model for you to get better.
Absolutely.
Okay, Katie, this has been such a joy. I've been so excited for this, and I think that my listeners are going to absolutely love this episode. First off, how can they get a hold of you? Say your Instagram handle. How can they look up, Old Bull Athletics online? Tell us all the things.
Yeah. So my personal Instagram is the letters KT and then my last name, Dabrowski. You can always DM me there if you have any questions. And we have 2 Instagrams for Old Bull, just regular Old Bull Athletics, all one word. And then our most recent opening of our second location brought upon Old Bull Athletics, Pinecrest. So we have those 2 Instagrams. Those are also great resources. We're very responsive if you guys ever have any questions or need anything.
And if you happen to follow Katie on her personal Instagram, you will see feats of strength, balance, and unbelievable circus things. So she's very, very talented. All right, Katie, any last thoughts to leave the listeners with today before we depart?
I think the biggest thing, just a reminder of how our bodies are really resilient, and we're made to withstand, and we're made to overcome injury, and we're made to get stronger, and we're made to move, rather than the narrative of, okay, we have just age-related declines, or once you get older, injuries are inevitable, or we're really fragile, or we run the risk of getting out of alignment at the drop of a hat. Just remember, regardless of your age, your experience with different movements, with your profession, anything, that resiliency is what our body is good at, not being fragile.
Amazing, Katie. And for everyone out there, just remember, strength training is healthcare. And this has been AZ and Katie, and we are out.
Thank you so much.